A lot of times, patient care navigators have backgrounds as nurses and social workers because that's what you need, right? They have the research and can know the ins and outs of the system. So I was talking on the phone to this very fast-talking American transplant. So he's a guy who has a private practice up in here in Toronto now. He's been here for decades, but he's from the States, and he's very much of let's get this done, let's figure out what needs to happen, let's just get on it, let's go, let's go, let's go. So in the case of someone who has dementia, what that means is he's going to sit down with you and your family and say, okay, where did you get your diagnosis? When did you get the diagnosis? What services do you know about now? Do you have a personal support worker coming into the house? Do you have respite care for the caregiver? Have you accessed all of the tax credits that are available to you as a caregiver? Do you know what those tax credits are? Okay, so then he's going to make a list of what you have in place. And that could be some things, like some people are very good at finding at least some of what they know and what they need and putting it in place. And then he's going to look at what you've got and he's going to say, okay, now let me apply my expertise and fill in some blanks here. Because what you might not have known about is that there's a hospital around the corner that offers this day program that takes up 3 hours, and there's room on their waiting list, and they can take your mom, and that means you're going to not need a personal support care worker in your home. And why does that matter? Because you'll save that money. Let's take that money from that personal support worker and put it towards a physiotherapist, because your mom also has diabetes and she needs some physiotherapy care, and we know that that's not always covered in the private system. So he's going to fill in the blanks of what services you are missing that may be available to you that you don't know about. Take the money that you're spending, because most people are spending money to get the care that they need. That most people are not fully able to take care of themselves with the public system alone. And he's going to show you how to shuffle that around so that your money goes further. And that's why I think it was important to mention the American connection, because the Americans have a much longer history of trying to get added value for their healthcare dollars in a way that Canadians just haven't had to do. We have a passive way of paying for our healthcare. It's through our taxes, whereas Americans know from the very beginning, I'm going to have money in the bank to pay for various services. This healthcare navigator, and there are many in the country in the private sector, and you can find them online, you can just search for healthcare navigator, there are many. That's what they do. Make your healthcare dollars, spent in Canada of course, it's Canadian, part of our Canadian system, make it go as far as possible with the end goal of having your loved one's life be as comfortable for as long as possible and without bankrupting yourself in the process.